Do you want to learn how to inject Radiesse for buttocks enhancement? Hi, this is Dr. J. Park with Cosmetic Medical Training. Radiesse for buttocks enhancement, also known as Radiesse Buttlift or Radiesse Booty Lift, is an off-label indication for Radiesse. This manual discusses the multi-layered injection technique for Radiesse in buttocks enhancement based on latest research and practices. The procedure uses different dilutions of Radiesse in various planes for a personalized, minimally invasive approach. Radiesse combines a volumizing component, carboxymethyl cellulose, CMC gel, and a biostimulating component, calcium hydroxyapatite microspheres. This combination provides immediate volumization and subsequent biostimulation, resulting in collagen and elastin synthesis. The calcium hydroxyapatite formation includes lidocaine for improved patient comfort. The unique property of the calcium hydroxyapatite is distinguished by their high G' and viscosity. Radiesse is contraindicated in the following: severe allergies. It's not suitable for patients with history of anaphylaxis or multiple severe allergies. Hypersensitivities. Avoid use in patients with known hypersensitivity to any components of Radiesse, including lidocaine or amide-type anesthetics. Bleeding disorders. It is contraindicated for patients with bleeding disorders. Warnings are as follows. Vascular risk. Injection into blood vessels can lead to serious complications like embolization, occlusion, ischemia, or infarction. Symptoms like vision changes, stroke sign, skin blanching, or unusual pain require immediate cessation of the injection and prompt medical intervention. Inflammation or infection. Do not use in areas with active skin inflammation or infection. Overcorrection. Avoid overfilling to prevent excessive correction. Lip use. Safety and effectiveness in the lips are not established. Nodules have been reported. Short-term reactions such as bruising, redness, swelling, lasting less than 7 days are common. Precautions are as follows. Practitioner expertise. Radiesse should be used only by trained, experienced healthcare practitioners knowledgeable about injection anatomy. Familiarity with products. Practitioners should thoroughly understand Radiesse and its usage. Cannula and needle use. Specific cannula 27 gauge and needle 25 gauge types have been evaluated for safety and effectiveness. Radiopacity. Calcium hydroxyapatite particles are visible on CT scans and plain radiography. Patients should be informed of this for future medical procedures. Risk discussion. Discuss all potential risks with patients, including signs and symptoms of complications. Infection risk. Follow standard precautions to minimize infection risk. Medication interactions. Increased bruising or bleeding risk in patients on medications like aspirin or warfarin. Post-treatment procedures. Patients need to be cautious with procedures like laser treatment or chemical peeling after Radiesse injection. Long-term safety has not been established in clinical trials. In specific populations, safety during pregnancy, breastfeeding, or in patients under 18 years is not established. Keloid, hypertrophic scarring. Safety in patients prone to keloid formation or hypertrophic scarring is unknown. Safety with other dermal therapies has not been evaluated. Herpes reactivation. Potential reactivations in patients with history of herpes may occur. Drug interaction and periorbital use. No studies on interaction with other drugs or implants, and safety in the periorbital area has not been established. Sun and heat exposure. Advise patients to minimize exposure to sun or heat for 24 hours post-treatment. Aseptic technique. Ensuring an aseptic technique during the session ensures prevention of infection. Single patient use. Do not re-sterilize or use if packaging is damaged, and avoid reusing the needle. Dispose of syringes and needles as per medical and legal requirements. Assess risk benefit for patients with congenital methemoglobinemia or those receiving methemoglobin inducing agents. Adverse events include the following: ecchymosis, edema, erythema, granuloma, nodules, pain, pruritus, soreness, numbness, contour irregularity, tenderness, and irritation. A correct patient assessment is crucial to a successful outcome. Indications include the following: this is suitable for patients seeking buttocks augmentation, treatment of asymmetry, cellulite, or increased self-confidence. It's ideal for those not suited for surgical augmentation, insufficient adipose tissue for lipotransfer, or sensitivity to anesthetics. Patients may have relatively low BMI with the following issues: cellulite, stretch mark, asymmetry, volume deficit, or skin laxity. The single layer injection technique is a 1:6 dilution technique. The choice of 1:6 dilution for the product is primarily influenced by its ability to achieve a broader and deeper distribution in the treatment area. This is particularly important for large tissue volumes such as buttocks, where extensive spread of the product is necessary to effectively stimulate the tissue. While higher dilution may result in a reduced stimulation per unit of volume of tissue, hyperdilute calcium hydroxyapatite still effectively promotes the production of significant amount of collagen and elastin. Although lower dilutions could potentially induce a greater stimulation of these proteins, you would need to use a greater quantity of products to cover the same area. The 1:6 dilution is ideal for collagen and elastin synthesis, and it's less ideal for volumization. To get started, first draw up 8.5 mL of normal saline into each 10 mL syringe. Attach a luer lock transfer adapter to a 1.5 mL syringe of Radiesse and to the 10 mL saline-filled syringe. Transfer the Radiesse into the 10 mL syringe to create a 1:6 ratio of calcium hydroxyapatite to saline. After hyperdiluting to a 1:6 dilution, replace the empty Radiesse syringe with another 10 mL syringe. Pass the Radiesse and saline solution between the syringe 20 times for homogenization. Repeat this step until the desired number of syringes are prepared. To prepare the anesthesia, draw up 2 mL of 1 or 2% lidocaine with or without epi into a 3 mL syringe using a 30 gauge needle. To prep your patient, have the patient stand upright for anatomical mapping. Draw mapping lines on the buttocks based on the desired clinical outcome, meaning shelves, hip dips, heart shape, or projection. Here are the detailed steps to doing the procedure. First, you want to prepare the site by cleaning each insertion site with anesthetic wipes. Inject 1 mL of lidocaine at each insertion point using a 3 mL syringe. If using Radiesse with lidocaine, additional lidocaine may or may not be necessary. We recommend using a cannula. So you want to insert the needle to create the insertion site hole. Then insert the cannula attached to the 10 mL syringe into the subdermal plane of the buttocks. Ensure that the cannula is in the correct plane by checking for resistance during side-to-side movement. Then now you want to start injecting the Radiesse hyperdilute solution. Begin each procedure by injecting 6 mL of bolus of hyperdilute Radiesse at the mapped location. Then retrograde the remaining 4 mL of hyperdilute Radiesse towards the insertion point. Slowly withdraw the cannula, leaving a small portion of the cannula inserted within the body. Then replace the empty syringe with a premixed 10 mL syringe of hyperdilute calcium hydroxyapatite. Reinsert the cannula and inject the next 6 ml bolus, leaving at least a 2 centimeter gap from the last bolus. Retrograde the remaining 4 ml towards the insertion site and repeat these steps until the desired area is fully treated. The post-injection care is to apply pressure using gauze for at least 3 minutes at the insertion point to stop any leakage, and you want to cover the injection site with Tegaderm. There are shape-specific augmentation techniques to be aware of. First is what's called the shelf pattern, where we aim for increased superior projection. You want to position the insertion point central to the x-axis and slightly above the midline on the y-axis. Place 5 evenly spaced boluses along the top of each glute, advancing the cannula superiorly, and retrograde the remaining 4 mLs of hyperdilute radius towards the insertion point. Second, the hip dip pattern aims to increase the lateral projection for a rounder appearance. You want to position the insertion point central on both x and y axis and distribute the bolus laterally, advancing the cannula towards the hip dip. Same thing, retrograde the remaining 4 mLs of hyperdilute radius during the withdrawal towards the insertion point. Third, in the harp shape pattern, we are aiming for a heavy bottom outcome in the glutes with excess skin and laxity or volume needs. You want to lay the bolus in the inferior portion of the glute and follow a similar retrograde approach as above. You want to be careful with this technique so that you don't make the buttocks heavy at the bottom. Most patients desire a lift to the buttocks, and creating a heavier, fuller bottom may cause patient dissatisfaction. The fourth pattern is a projection pattern, which aims to round out and correct the overall appearance of the buttocks. Use the same centrally located insertion point and place 4 mLs of bolus in a complete circle around the buttocks. And you want to deposit the 4 mLs in a retrograde to correct all surrounding areas to create an outward volume. Next is a different technique, which is the multi-layered injection technique, which uses multiple dilutions, 1:1, 1:2, and 1:4 for hyperdilute radius. First, you want to conduct a comprehensive assessment focusing on 3 areas: shape, sagging, and cellulite. The shape is categorized into 4 types. A-shaped, where there's more fat in the lateral upper thigh and less in the lateral upper hip. V-shape, where fat predominantly is located in the upper lateral hip area and minimal in the lateral upper thigh. Short square shaped, where there's equal height and width. And a round shape, where there's excess fat in the center of the buttocks. Sagging is assessed on a scale from no skin laxity to very severe skin laxity, and cellulite is graded from none to severe, characterized by visible nodules, elevations, and discomfort. The tailored evaluation involves prioritizing the patient's concern based on clinical findings such as roundness, cellulite, and sagging. This combined assessment helps in identifying the primary focus for treatment and influences the price and quantity of fillers used. For example, if a patient has a V-shaped buttocks, many syringes of filler will be required to create an A-shaped buttock. Customized dilution and marking. Each buttocks is segmented into 4 quadrants, with each quadrant marked based on the patient's desire. Dilution and injection planes are as follows. For cellulite, you want to have a 1:1 dilution and inject it into the superficial subcutaneous layer. The 1:1 dilution is intended for the hypodermis and its septa and is more concentrated and targets the cellulite. The cannula is introduced at a 15 to 30 degree angle for this dilution. For shape and volume, you want to do a 1:2 dilution, targeted at the deep subcutaneous layer, A 1 to 2 dilution is injected into the connective tissue and fascia at a 30-degree angle. This approach aims for creating collagen and providing structural support, potentially lifting and volumizing a larger area. For sagging, you want to have a 1 to 4 dilution and focus on the subdermal layer. For a 1 to 4 dilution, radius particles are evenly dispersed in the subdermal layer to enhance skin quality using a cannula angled at 15 degrees. This dilution covers a larger area than the previous 1 to 2 dilution. These dilutions are designed to target different layers and enhance outcome through multi-layered injection to create collagen. You want to premix a solution of 25% of 1% lidocaine and 75% of normal saline under sterile conditions. Please look at the table for the amount of radius needed versus a lidocaine saline mix to create a 1 to 1, 1 to 2, and a 1 to 4 dilution. For a combo treatment for cellulite, you want to use the traditional 22 gauge cannula in a fan-like motion, supplemented by direct injection with a 27 gauge needle into each depression. To define shape or address sagging, the solution is injected at varying depth and dilution as per the standard protocol. After procedure care involves the following. Advise the patient to avoid pressure on the treatment area, strenuous activities, and submersion in water for at least 48 hours. We recommend oral NSAID medication as needed. Keep the tegaderm in place for 48 hours post-procedure. Perform active circular massage twice a day for 7 days following the procedure. Complications and adverse events such as bruising, swelling, and soreness at the injection site are common. Serious complications like granulomas and vascular occlusions are rare but possible. You need to have protocols in place for managing both serious and non-serious adverse events. The hyperdilute Radiesse offers a customized, patient-specific approach for buttocks augmentation. This minimally invasive procedure provides immediate volumization and long-term biostimulation, resulting in a natural-looking symmetrical and enhanced buttocks contour. The technique is adaptable for various clinical outcomes and is an effective alternative to surgical procedures. This is Dr. J. Park with Cosmetic Medical Training. You just finished watching the Radiesse Buttlift Training Protocol. If you have any questions, please contact us by email or phone, and we're happy to give you assistance in training, hands-on, as well as any consultations you need for your med spa. Thank you.